complete that part. You know, it's funny because that's what I wanted to say too, but while I was listening to your presentation, I found myself becoming strangely emotional on the verge of tears because I'm seeing all of my friends who either died in prison because there was no hope of compassionate release, or who got out, my dearest friend and co-defendant who got out 20 days before she died and had a miserable existence once she got out because she was in so much pain. And all of that does go to exactly what Fareed's saying. So one thing, and just, I hate to do this because you're doing such great work. The word inmates, the word offender, we try to get away from those because, and I know you're dealing with numbers and large quantities, but I'm seeing the faces of people. And those faces and those stories are what fuels this. And that's the irony of this whole issue and why it's called medical prose, compassionate release. That's what we called it when I was locked up. Compassionate release, that's how we thought of it. And it's a fake term in this country because as soon as you exclude certain categories of crimes, not of people, but of crimes, then compassion, which is supposed to be something that's a human emotion that's given to anyone, is only for certain people, which defines so much of the system in this country. So in terms of the reforms and the changes, I think the main one is parole should be taken out of this. It's like in New York State, okay, so there you are, you're paralyzed, you have like 5 months to live, and the survivors of the crime that happened maybe 50 years ago get to decide without knowing anything about you, because in New York State and in most places, the cult of victims impact statements, which only came in as in the development of mass incarceration in the 90s, became the issue, and yet those people have no idea who the person is now. All they know is what happened when their loved one died. And so we have a system that's based on the fury, which is, you know, is totally understandable, the rage, the hurt that people feel when someone has taken away their loved one. But our solution is to create more hurt and more revenge. And so that idea that people are happy to think of people suffering in prison is, you know, underlies this. And when you talked about what has happened, you know, the stingy use of compassionate release, which the one thing I think you didn't mention was the lengthening of sentences, the actual institution of longer sentences that came about. You know, mass incarceration rose after the 70s, partly because the 70s were a time of massive upheaval in this country, led by the Black Panther Party and the Native American struggle and other indigenous and national liberation movements. And so part of the repression that meant that communities couldn't do that anymore was mass incarceration. And so you see longer sentences, you see the victims' rights movement coming into play, and you see an end of compassionate release, actually. And I think that would be one thing that would be interesting to track numbers and policies before, let's say, 1970 and after, and see if there were changes. But the federal system, even the Sentencing Commission, which is a federal, do you know about that, the U.S. Sentencing Commission? They made recommendations because the compassionate release was not being used in the federal system. I mean, even, you know, those are middle-of-the-road people. So the fact that the decisions are made by the parole board just puts people in the same position of begging for their health and lives from the same institutions which are founded. And, you know, we've been doing a campaign right now about who the parole commissioners are in New York State, and it's so hard to say they shouldn't come from law enforcement. Law enforcement got their chance at trial. You know, the victims got their chance at trial. Now when you're ready to get out, why should it all be, you know, the same people get another shot? So those are some of the things I think. I think that the categories, I would urge that a recommendation be that the definition of who's eligible, since we do have, as Michael said, this crisis of aging, be also something that was suggested by the Sentencing Commission, and I can't find out because I'm not a good researcher, and I don't have students I can assign what got into the federal compassionate release statute, but they were suggesting that it should be that you have either terminal or all those things, or a chronic illness or condition which will become worse with age, can be expected to become worse with age, which cannot be managed in a correctional setting. And that's a different standard, because that would mean that tons of people would get out, because, we used to say, which is true, this prison health care is an oxymoron. Prisons are not only bad for your health, but prison health care is run by security. So I would urge that there be a much broader standard, and that we look at someone like Robert Seth Hayes in the New York State system, who's pushing 70, has a really intractable diabetes that's very, very hard to manage. And not because of just the bad quality of healthcare in the prison system, although there is that, but because it's just really difficult to manage in a prison. He should get medical parole, even though he's not facing death at this moment. But if they can't control his diabetes, he certainly could face death. And he was turned down immediately for medical parole. So I think those are some of the things, and I just think that what Fareed said is really important, that compassion should not be punishment, should not be based on punishment. And I know this is somewhat radical, because, when you look at the whole thing about, one last thing, because people have been seeing all the news about Alice Johnson, who, yay, got out of prison, but woo, Trump gets to say that he did this. But the other thing is that even the left progressive media keeps saying this thing. There are, which is true, I was in the federal system, there are all these people who should not be serving life sentences for a drug conspiracy. But they keep saying because they're nonviolent drug cases, they pose a very low risk to public safety. So the whole definition of public safety, because we know that people who commit first-degree murder, which is the thing that's always excluded from everything, are the least likely to commit another crime. So where's public safety and all of that? So that's why I think the thing Fareed said about education is so important, because those are concepts that people just accept. Drug crime, low risk. Murder, high risk. But it's not. It's if you're over 50 and you commit a murder, you have the lowest risk of recidivism. So those are some of the things. But thank you so much for your research. And thank you for inviting me to run my math here.
Thank you.